Hello, everybody, and welcome to another dental shadowing session. Today, we have general dentist Dr. Azadi here with us, who's going to give us an awesome session, tell us a little about his dental journey, as well as what he's doing right now. So you can go ahead and take it away, doctor.
Thank you so much. All right. So a little bit about me. So I know a lot of you guys are, some of you guys are even in high school applying for undergraduate studies. Some of you guys are in undergrad and, applying to dental schools. Very cool that you guys have this all set up. I know a lot of you can't go in and shadow and can't meet and greet with, your local dentist and get that experience. And a lot of you are in a stage where you're trying to make, life decisions. So this is very cool. I'm very happy to be a part of this. So thank you so much for having me, first of all. So a little bit about myself. I was born and raised in Miami, Florida. Um, I went to Florida State University for my undergraduate studies. And I went to Creighton University in Omaha, Nebraska for my dental school. So, let's see. Perfect. All right. So, why are you here today? I'm assuming most of you here because you guys are looking to decide your future and you guys want to, pick a career that you love, but also that you guys can thrive and grow in and help people, hopefully, right? Um, why am I here today? So I'm here because I've already kind of gone this path and I'm here to, help give you a little bit of information on, the steps that I took and what I did to get to where I'm at and tell you a little bit about a day in the life of, a dentist, a general dentist who's also a practice owner and to give you guys a little bit more information on, just to kind of give you an idea if you think this is something that's going to be for you. Okay. Um, so a lot of our patients, a lot of people aren't the biggest fans of dentists. So I always think it's a very cool thing when you can make an anti-dentite into a forever patient. So that's part of the reason why I got into dentistry myself. I have a big family, and a lot of them didn't love coming into the dentist, but they did a really good job of getting me to go when I was young and staying on top of things. And um, throughout my childhood, I had a couple of things, a broken tooth and braces that really, made me pretty fond of dentistry. I thought, hey, this is pretty cool. The things that we're able to do and how it affected my confidence to have nice straight white teeth and different things like that. So I kind of want to do the same thing for other people. So that's pretty much why I decided to start looking into dentistry when I was at around the same stage as most of you guys are. Um, and that's kind of what got me into wanting to shadow and learn a little bit more about dentistry and see if this is something that I thought was going to be for me long term. Okay. So like I said, my journey, I went to my undergraduate at Florida State University. Then I went to dental school at Creighton. After that, I worked in Orlando for about 9 months. And I was working at a large corporate practice that was seeing a lot of Medicaid and HMO insurances. It was a very good experience. I got to see a lot of different patients, most of it who don't really have many other options as far as where they're going to go for their treatment. And as to providers, they could see a lot of people were coming from very far to come see our office because no one really took those types of insurances. So coming out of school, it was a really good experience for me. Kind of like a paid residency, I like to call it. I had another older dentist who was there to kind of help me if I needed any help or had any issues. And I got to be very busy right out of school, even though I didn't love the model long term. It was a good experience for me. And then I went ahead and went to a private practice, moving down to South Florida, kind of close to where I'm at now. It's in Pembroke Pines, and I worked there for a little while. And I like that setting a little bit more, being able to see less patients and really give them the great experience that I've kind of got into dentistry to give. But I did want ownership. I did want to kind of make my own practice and make my own model. And I partnered up with a company that helps you kind of get into private practice ownership. It's Pacific Dental Services, and they build out these big, beautiful offices with a lot of technology and kind of let you run the show. So, now this is where I'm at. I have a practice in Davie and I have a practice in Deerfield Beach, both in the Broward area, so not too far away from where I grew up in Miami. And like I said, clinician and business owner. I do like the business side, and I'm very lucky that I have a team of people within this company who can help me answer any kind of business questions or give me business ideas, because none of us really get MBAs in dental school. We don't really know what we're doing. We're trained to fix teeth. We're trained to fix smiles. We're trained to help people, and going that path can be a little difficult if you're doing it on your own and you don't have anyone, family members or anything like that who come from dentistry, which I didn't. Um, So a day in the life, dentistry is just what we do for a living. All of us have to have our own social lives, and but it is very important to love what you do, which I do. We work a lot. You work too much to not really enjoy what you do and feel like there's a big purpose in what you're doing. About me, I like to travel. I have I am from a big family. I don't have any kids of my own yet. I do have I have a fur baby. I have a puppy. It's not a puppy anymore, but I live with my fiance. I'm actually getting married next month. So, I think it's very important to, have a life of your own, and outside of work, I really like to, play sports and try new restaurants. And when I'm able to afford to, I go and try and travel the world as much as I can, see different countries and take vacations and do stuff like that. But a typical day of work, I'm probably looking at waking up around 6:30, 6:45, depending on which office I'm going to. One's a little closer than the other. Make my breakfast, make my coffee, head over to work. I like to get there about 15 to 20 minutes early, sometimes a little bit earlier. I like to lead a morning huddle, and at that time, we try to talk about something maybe from the day before, the week before, that was good, maybe talk about some opportunities that we've had. And then I like to go through the schedule for the day, talk about the hygiene schedule, what's going on, which of these patients have pending work to do, pending treatment to do. We also talk a little bit about, the new patients, what they called for, what they're looking for, just to kind of get an idea of how the day is going to go. The more we communicate before the day starts, the smoother the day will go. I do have a couple of associates who work with me. I have three associates between the two offices. So, sometimes I'll have two providers the same day, plus hygiene. I have a couple of specialists who filter in throughout my office. So depending on the day, we're looking at like a different type of schedule, different things that we need to go over. But essentially, my days are either going to be 8 to 5 or 10 to 7. We try and accommodate these patients who are coming in after work. We are open Saturdays, so I'm usually here like every other Saturday. I switch up with my associate. But typical work week is 5 days. Get in around 7:30, 7:45. Leave when the patients are done, ideally around 5. Sometimes a little later, depending on if there's an emergency, if we run late, things like that. Yeah, types of procedures, everything like that we do. You're usually looking at me as a general dentist. For example, my day today, I did a root canal and a crown on one patient. I had another patient who we did, my hygienist was a little backed up, so I actually did their scaling and root planing, or their deep cleaning, myself, along with another one of his, another crown. And also did another patient, we did two wisdom teeth extractions and another extraction. Grafted it, prepared it for an implant, the other tooth. Um, let's see, what else did I do? A couple exams, one kid, a couple adults, delivered a denture, did a couple post-ops from procedures we did last week, and delivered two Invisalign trays. So that was pretty much my day today. Not an untypical day. Usually pretty wide variety of procedures we do. I try to stick to easier root canals and things I feel really comfortable with versus doing everything, and that's why I bring my specialist in for the more complex cases. And this way, patients don't have to go out to another office if they have an issue, and we can offer that to them. If, let's say, my endodontist is here next week and they can't wait, we can offer them to try to find another office for them. But we really try to take care of everything in one office, whether it's implants, whether it's all on four, root canals, periodontal work. Yeah, I mean, we try our best to do that. Oh, so here's my fur baby. Here is my puppy. Well, this is when she was a puppy. She's a year and a half now. I used to bring her to the office sometimes because my fiance is a nurse practitioner and she used to work night shifts at the hospital. So sometimes when she wasn't able to take care of her because of her work schedule, my work schedule, I'd take her to the office. But I brought this slide up because you know we're here to help our patients. End of the day, for those of you considering dental, it is a pretty cool world where we don't have a lot of responsibility, and we have a lot we can do to help our community and help our patients and provide a service. We also have a little bit more flexibility, I like to think, than an MD or someone in another profession. A lot of opportunities for ownership. There's a lot of there's a little bit more flexibility as far as work schedules. I mean, I know some dentists who work 4 days a week and 8 to 5 or 8 to 4, 9 to 5. So you can be whatever type of dentist you want to be. You could be a specialist. You could be you could work in a underserved community or a public healthcare type place. You can work for a big corporate. You can work for a private practice. You can be in an office that sees 30 patients. You can be an office that sees 5. There's always opportunities. That's the good thing. There's not a bunch of dental schools, and it's relatively easy to find jobs. Good career, even if you don't want to be this big time business owner. There's a lot of opportunities to make good money and just kind of work your job and treat your patients and do your best. But end of the day, we get into this profession because we want to help people, and we find it fascinating, the craft of fixing teeth. And there can be an artistry to it if you want to. We do a lot of veneers, crowns, Invisalign, things like that that can really affect people's smiles. We also treat a lot of emergencies, right? I see patients who come in because they broke their tooth, and they're in so much pain, and we help take care of them. So we're really here to help our community and help our patients feel more comfortable and take care of what their chief complaint is, or what they came in for that day. So I think that's important when you're getting into the field, is kind of knowing what you're getting into and why you want to do it. You don't want to get into something just because it's a good paying job. All right. So just a couple cases. I'm not the best at taking before and after photos. My fiance got on me about it for a while, so I did it for a couple months and I kind of stopped. So I wish I had better pictures, but I do have a couple of cases that I kind of pulled out for you guys just to kind of see some cases that we do. This is a patient who came in. He was a big time teeth grinder. He had he also had a lot of crowding issues. You could see if you look at this picture over here to the top right of your screen, you could see the upper left front tooth over there had chipped. You could see the lower teeth are kind of pushed back in, and you could barely see them in his smile. Even when you pull down the lips, they look very kind of pushed back, and the front teeth are covering up most of his teeth in his smile. So you could see just by doing a couple of crowns on the top and a couple of crowns on the bottom, not only were we able to protect his teeth, which is something that he needed because his teeth, like I said, he was grinding at them and wearing them away and chipping them. But we were able to give him a much nicer smile. You could see his smile line has even changed. It looks a lot nicer and more even. We fixed his crowding by pushing out those lower teeth a little bit. And this was all accomplished in a couple of weeks. So, there's a lot of things that we could do, like I said, relatively quickly. Another thing I love about dentistry is just how it's evolving with technology. So I know that, this wasn't the best example. I didn't really have too many good pictures, and most of the stuff I had were pretty cool videos, but I had a tough time uploading them. I'm not a tech genius. So this is actually a screenshot of a CBCT, which is a cone beam. So this is a two-dimensional slice of a three-dimensional X-ray. If you actually look at the bottom or towards the right of this picture, you can kind of see where I extracted it from. There's a scan of the patient's mouth. So in our office, if there's a patient who has reason for it, we can take a three-dimensional scan of their mouth, of their teeth, and we can see a lot of things that we can't see on the old school two-dimensional X-rays. So this is an example. I wish I had the regular X-ray of it. It shows like a small little line around the tooth on the two-dimensional X-ray. And from this side view slice, you can see how massive this infection is. All of that shadow behind the tooth is infection. And this is a tooth that had a root canal. So this patient came in with a massive swelling, infection, pain, had a root canal done a couple years ago at another office. We were able to take a look at this and get another view. I sent it to my specialist, who's an endodontist, to consult for either redoing the root canal or doing surgery on the tooth, or even, potentially removing the tooth. And I think that's what we actually ended up doing, is going with an implant, if I remember correctly. Here's another case. This is a patient. He was a pretty rampant soda drinker. Very young, very nice guy. Most of his teeth are decayed. He was very afraid to go to the dentist, and he said he always had issues every time he was there as a kid, and his parents kind of stopped taking him because of, the expensive things and the issues. And like I said, the guy tells me he probably drinks like 6 to 7 cans of soda a day. So this kind of shows you a guy, mid-20s, already the damage he's done to his teeth. You can see how broken down they are. You can see the chalkiness of the tooth structure, the grayness and the blackness. That's all decay. That's all cavity. A couple of the teeth were actually starting to form infections. So they needed root canals, crowns. He actually needed an extraction. And like similar situation, pretty quick turnaround. We were able to, give him a better, improved smile, fix his teeth as well, make them nice and strong. And, he told me he chooses one soda as a treat for himself every day now. We have him on a prescription fluoride toothpaste, and, he's doing good. We did this case about a year ago. He has no new cavities. And just really rewarding to see how you can kind of affect someone and affect their smile and affect their life. I'm hoping that he continues to take good care of himself and, keep this smile that we gave him for a very long time. So, I know I spoke a little bit about technology, and, I'm a big fan of technology, and a big reason why I went with the team that I did, and to the management company that helps and, is partnering with me in Pacific Dental Service. They do supply these offices with pretty awesome technology. So this is a picture that I have of our CAD CAM or CEREC machine. So essentially it's a digital, this is the scanner portion of it, of course. So this is a digital scan that we took of a tooth after this patient had a tooth that broke. That dark area is area that we had just excavated and removed cavity. But, so this is one of my associates, Dr. Gutierrez. She just finished up her shift. So yeah, good job, Doc. So pretty cool. We're able to take some intraoral photos of the tooth, intraoral scans of the tooth, and we're actually able to mill and make a crown for this patient the same day. So back in the days, they used to have to prepare the tooth, take an impression, send it to a lab. Some lab tech works on it, sends you back to you. You have to try it in. Now we're able to do that whole process in about an hour and a half to 2 hour appointment. So we numb, we clean everything out, we scan it. You don't need to leave with the temp. You can leave with your permanent final restoration. So pretty cool the way that the field is evolving and all the technology. This is one of my favorite things, and advances in dentistry in general. So, here's another photo of the same stuff. So this is actually the milling unit. So after we take the digital scan, if you look to the upper right, we designed the crown. So this patient had a lot of spacing. So the tooth that looks a little bit more white is a crown that I'm designing for this patient. And then this is an example. You see the blue thing in the milling machine. This is an example of a crown being made. It starts off this purplish blue color, and then we use these different paints, not paints, these glazes on the lower right. And those are how the crowns gain their color. And we can custom stain them, and we can do a lot of different things with them. If there's a very complicated case, sometimes we'll send it to a lab technician to do custom staining and do some more detailed work. But a lot of really cool things we could do just same day within a couple of hours for a patient. So this is a case that we did where we are in the process of replacing all of his teeth with a permanent implant solution. So this patient came in, he had a couple of implants, couple of teeth, everything kind of broke on him, failed. He came in after a long time of not going to a dentist, and he had paid for all that work. So along with my periodontist, who's my gum, bone, and implant specialist, we planned out this case. We planned out a surgery. We placed 4 implants. The patient actually had a more complex medical history, so we had to get him to stop smoking. We had to kind of get his diabetes under control. This is basically showing you the conversion of this piece in his mouth versus his cast. Those are basically to replicate how the implants look. And we ended up not too long ago, actually, I finished up this case maybe a month, maybe 2 months ago. We ended up restoring his teeth with essentially what we call an all-on-4, which easier terms is essentially like a non-removable fixed type of bridge that goes over these implants. The easiest way to describe it, that we screw in. Okay, so he has now a permanent set of teeth that are held by these 4 implants. Every year he'll have to come in, get the screws changed out, but on a day-to-day basis, he doesn't ever have to take them out or do anything. He can use them like normal teeth. So very cool. I talked a little bit about where I work. Like I said, I partner with a company called Pacific Dental Services. They are a DSO. They build out these big, beautiful offices, and they find hungry docs who want ownership and want to kind of run their business and treat the patients in their community. And they partner with people like myself, and they build out these big, beautiful offices, and we kind of run them the way we want to dentally, and they kind of help us with a lot of the business side and support. I always knew I made a good decision coming on board with them, but especially during coronavirus and all these crazy times, their support has been awesome. If I had I can't tell you, luckily no one here really contracted coronavirus, but I can't tell you how many times I had, I was at my aunt's house and she ended up testing positive, and now I need to quarantine until I get my results. And we had so many short notice cancellations between my hygienist and my assistants, even my manager. And it was just so amazing to be able to get that support of, we have someone who can help cover, and this and that. So definitely, validated, my decision to kind of go with this route. I can't imagine having gone through this past year as a private business owner. I had no idea what I was doing with filing for all these business loans and all the support stuff that we had to do. So I felt very lucky to kind of be a part of a great company who was able to support me when I needed it, but also kind of lets me run my practice the way I want to. So very cool. For those of you guys who are already in dental school or applying to dental school in the future, you could find one of our practices to shadow once this craziness all settles down. So getting back into the application process of things, I just wanted to kind of give you guys a little bit of information on cases we do, give you some before and afters to kind of hopefully get you guys a little excited and interested. But back to when I was applying to dental schools or even undergrad, for undergrad, I went to my state school because I had a scholarship and I didn't want to go and pay for a private school and things like that, especially because the local schools around me didn't have dental schools anyway. So it didn't really make much sense for me. Now, best advice for applying to dental schools, apply to a lot of them. A lot of them have, a lot of rules and, a lot of them have different start times and requirements and things like that. So to put yourself in the best position, just apply to a lot of them. Majority of the people applying are going to be similar type candidates. So try and find something that can stand out for you, whether that's, good recommendations or extracurricular activity, mission trip, something like that, is always good. But I think the most important thing, especially if you're a pretty typical applicant, is apply as early as possible. Get everything, get all your ducks in a row, and apply that first day that application windows open. Get your application out, get all your recommendations submitted. It does take a while because these schools are looking to interview early. And when you don't get your applications in until right before that acceptance deadline, your interviews may be set up for after that December or whatever date it is they do all their acceptances. So make sure you apply early, apply right away. I promise you, you will get double the interviews if you apply within that first month than you would have applying 3-4 months later. Because, and even once you interview, if you get those interviews that are past December or January or whatever it is, they have filled most of their spots. Now they're waiting for people to reject them before they start adding more people in. So you're putting yourself at a disadvantage. So my best advice is apply early, pick 12, 15 schools at the minimum that you want to apply to, because I guarantee you, you won't get interviews at half of them. And it'll be the randomest reason. So I got interviews at some schools that were really, really good, and I thought I had no chance at. And I didn't get interviews from some schools that these books told me were really easy to get into. So a lot of it didn't really make so much sense. So I would say try to pick a lot of schools. Don't be so picky. I went to Omaha. I'd never been there before. I froze my ass off for 4 years, but it was a great experience. I met a lot of great people. I think it was a good experience for a Miami boy who chose all of his vacations to be in, Europe and, like all these other countries and islands and stuff like that. I never really traveled the Midwest or traveled, all my traveling within the United States was New York and California and all the big states, Hawaii. We never went to the Midwest and saw, how nice these people were and how much they had to offer. So don't get your mindset on applying to only certain schools. Just be open and go get that experience and apply anywhere, everywhere. It doesn't really affect the outcome of your job when you're applying to for positions. So that'd be my best advice for those people applying. And I went to dental school with a person who was an ancient mythology major. I went to school with like people who were business majors. They just took all the prerequisites and courses. So, I mean, there's a lot of ways to do it. So if you're one of these people who, isn't on the pre-dental path with biology or chemistry like I was, or biochemistry, like a lot of people are, there's still ways you can get into school without picking one of those majors, right? Just know the prerequisites that these schools are offering. Try to pick up those courses and get them done. You have a good GPA and you can get yourself an interview, you can still get in. I even had friends who had to do like master's programs for a year and then they got in because their grades weren't good enough, or they last second decided they wanted to do dental and they didn't have all the prerequisites they needed. So there's a lot of ways to do it. I know people who applied 3 times, 4 times, and ended up getting in. So don't let that discourage you. Okay. I was actually myself on like 3 or 4 waiting lists because I wish I had someone to tell me the advice I just told you guys. I actually applied very late. I probably took 4 months to get my applications out. All my interviews were past December, and I got on a ton of waiting lists because of it. And I actually already reapplied for the next cycle by the time I had gotten into dental school. So they called me to give me my acceptance 2 weeks before school started, dental school started. Someone dropped out last second. They called me, one of the schools on my wait list, Creighton, and they asked me if I wanted to go. They said school starts in 2 weeks. And I was just like, wow, like, that was so last second, but it ended up working out. And, here I am today. I did well in school, had a great relationship with all my instructors, and, I got in at the very last second. So, don't let that affect you. All right. So, hopefully I didn't go too fast or ramble, and hopefully we have a couple of good questions. Don't be afraid to ask anything when it comes to, applications, my practice, Pacific Dental as a company, applying to dental schools, applying for jobs, whatever it is, feel free to ask away. And hopefully I could help you guys with some answers.
All right, our first question in the chat was, how many patients would you see in a typical day?
So at my practice now, I'm averaging about 12. I think 12, I would say probably like 10 to 15 on an average day. At my first practice, where I told you didn't really love the flow of things, it was a little too hectic. I was probably seeing anywhere from 20 to 30 patients a day. So it was a lot. And, to the point where, you'd go into a room and, a patient you've already seen before a couple times and you don't even remember them because you're moving so fast and you spend so little time with them. So I really wanted to get out of that structure because for me, I wanted to be able to give my patients a great experience and provide them with high-end technology and high-end work, and really wasn't that type of practice, but it was a great experience for me.
And then someone in the chat had asked what made you choose to be a dentist, but then there's the following question that said, what made you choose to be a general dentist? So I guess the two can.
Yeah, so choosing to be a dentist, like I said, I thought it was very interesting. I had a tooth that broke when I was younger, and I took me a while to get it fixed, and I was really self-conscious about it. And getting that fixed, also, I really thought it was cool when I had a lot of crowding with my teeth, and getting braces I thought was really cool to how it affected my confidence after I had a beautiful smile. And that just got me interested in dentistry. My grandfather was a dentist. I never met him. He passed when my mom was really young. So I didn't have much influence, but it always kind of had that in the back of my mind. And I really, fell in love with it when I started shadowing and seeing some more things about it. But that's how I got interested in the first place. And why general dentistry? I actually, when I went to school, I thought I was going to want to be an orthodontist. But the cool thing about dentistry and dental school is you kind of get thrown into all different types of rotations, and you have all different types of courses, and you see all different types of patients. You see ortho patients, you see oral surgery patients, you see endo patients, all the specialties. And I thought I wanted to do ortho, but I realized, to me, it was boring as hell, and I didn't end up liking it at all. And I ended up liking things that I didn't think I would like. I really loved surgery. I really loved Crown and Bridge and emergency type dental work. And, it just really wasn't for me. Kids are difficult to work on too.
And then another question here in the chat was, how did you handle the stress of dental school and manage your time?
So, the cool thing about dental school is you're going to find out, you're going to make some of your best friends in the world in dental school. I'm over 5 years out now, and I still keep in contact with, probably, I mean, just coming to my wedding, I have 8 friends from dental school coming to my wedding, maybe more, eight friends coming and I had one who actually ended up moving down here, who has never been in Miami. He came to visit me, he loved it, and now he's moving down here. He's working for the same company. He owns another office of his own. And you have such a good group of people around you. You're all on the same schedule, you're all under the same stress. So building a good group of friends who are kind of all on that same track is just huge, because now you have people who you guys, when you have a test, everyone's there studying together. When you have nothing to do, everyone's going out together, socializing. So you get that whole mix of, de-stressing and having a life. And you also can prioritize your work because everyone else around you is doing the same thing. But yeah, in dental school, I played 2 to 3 intramural sports. I was lucky to not have to work a job. I just took out loans. Well, not lucky. I just took out a bunch of loans and I'm still paying off. Have fun with that, guys. I don't think that's going anywhere. um, and I was still able to go out with my friends, probably once a week, go out, and then I was, going out to dinners and things like that during the week as well. So I mean, there's still time to do things as long as you prioritize your time, and you hang out with the right group of people who all have that same mindset of you, not just being there to party, but like, I want to enjoy my life, but we also want to get good grades and get through this thing together.
And then I know you mentioned to apply to a lot of dental schools, but
Mhm.
what was something that you kind of looked for when you were applying to different ones?
So, I mean, I had this booklet. I'm sure they still have it. I don't remember what it was called, but it kind of gives you like the average acceptance by GPA, by DAT score. And I think I was at around like a 3.6 and a 20 on my DAT. I think I was at like a 20 on the DAT and like a 19 on the PAT or something like that, and a 20 on my sciences. And I was just looking at schools that were kind of within my range. I wasn't going to apply to Harvard and waste $200 on an application, but I tried to find all the schools that were kind of within that range. A lot of them were cities that I, knew someone, or that I had heard were very good schools. Or the reason why I actually had Creighton at the top of my list, even, it was a city I knew no one, it was freezing, I didn't know anything about the Midwest. Creighton is a school that has no specialty schools. So, for example, Nova around me has specialty programs. So, let's say as a student, I have a patient who needs a root canal. I don't do the root canal. I send it to, this endo resident who is at my school. At Creighton, where I went, you have a patient who needs a root canal, you do it. You have a patient who has wisdom tooth, you do it. You have a patient who, needs some kind of crazy thing, you can do it. You don't have to do it, but you can do it. Um, so I had a lot of opportunity to try different procedures and do a lot of cool things. So that was another thing that I factored in, was which schools have good clinical experience, which schools have good reputations, but also schools that seem realistic that I had a chance of getting into.
And then another question here was, if you had to go back as an undergrad, what major would you choose and why?
I did bio with a minor in chem, and I would say I would do the same. The reason why is because through getting my biology degree, all my prerequisites were pretty much taken care of. A lot of these people who did do other majors, a lot of them had to do extra semesters, or, take 15 to 18 credits a semester just to get their major done and also get their prerequisites done. So everything kind of fell in line with the bio major. So, I mean, that worked out really well for me.
And then another question in the chat was, how did you prepare for the DAT?
So I did, I think it was called like Chad's videos or something for, I think it was for chemistry and orgo. I did the Kaplan course, which was really cool because they had a lot of online practice tests, which, I like to kind of test myself and see where I'm at. Um, I also did a couple of just those. There was like some books that some people had recommended to me. They were like, I think they were actually AP bio books or AP chem books or something. A couple people had recommended those to me, so I skimmed through those as well. I took a lot of practice tests because, you know, at that age, you're not really used to taking a lot of long tests. So just to sit there and stare at science questions all day is like a huge headache. So I like to try to prepare myself by taking these practice tests and going through material and things like that. Especially perceptual ability. The PAT portion of the test was just like you don't do nothing in your life that prepares you for being good at that. You're either good at it or you're bad and you really need to work at it.
And then I know you mentioned about the orthodontist thing, but someone asked, like, did you did you ever actually consider being a different type of dentist? So I guess how can you really know what you want
Yeah.
to?
Yeah. So, when I was in school, I realized I really liked oral surgery and extraction. So, um, oral surgery is a 4 to 6 year program, and that was kind of the thing for me. I didn't really want to go back to school, and not only that, but it's the hardest residency to get into is oral surgery. So usually it's like the people who are like top 5 in the class, and I was kind of like more towards the middle of the class, maybe a little higher than the middle, but I wasn't I probably wouldn't have got in unless I had a really kick-ass recommendation, which I probably could have gotten. I was close to some instructors, but it I did like the ability to do everything. I think that's the cool part of general dentistry. I like the business side of things to a degree. Um, I didn't want to go back to school and have like $1 million of debt, so that was another thing that I had to take into consideration too. Start your life a little sooner.
Yeah, and then I guess a lot of people are actually wondering how, you have to keep up with your GPA, do good on the DAT, but like they're still asking a little bit about time management. So I guess what are some skills or things you've acquired that you can kind of advise us with?
Yeah, so I tried to use my weekdays wisely. When you're in dental school, you are in lectures all day, in labs all day, or clinic all day. And usually a lot of people get tired by the time they get home and they just want to be a vegetable, or they want to go out and have drinks and eat and do all this stuff. I really tried to use my time wisely. So whether that meant like if I had a break or class got out early and I was still at school, or if I had a longer lunch break because a patient canceled, I would go to the library and study. I would try to use my day while I was already at school or like an hour after school to study, do homework, do all that stuff. That way, when the weekend came, unless I had a big test, I didn't have to go kill myself and lock myself into a room or the library for the whole weekend. And not to say that didn't happen. I mean, there were some weeks that were just so overwhelming that you have all these tests coming up and you have no choice but to lock yourself in a room for a week or two. But that's the minority of the weeks. That happened a couple of times a semester versus it being an every week thing. So I tried to use my time during the weekdays very efficiently because I knew on the weekends it was going to be something that was going to tempt me to not do homework and not study.
And then another question here was, how long was the application process when you applied to dental school?
Long in what sense? Like, how long did it take from me applying to getting accepted, or how long did it take to fill out all the information?
Both.
Okay. So, like I said, I already filled out the application a second time when I had gotten accepted from the first round. The first time I kind of waited to the last second to get all of my letters of recommendation. Those took forever to get back from people. So ask for those in advance because I waited till the last second and then I had to keep bothering people like, hey, my letter of recommendation, don't forget. And I'm waiting to submit an application that's very important. And then you don't want to annoy this guy who's telling people that you're a good candidate. You don't want to piss him off. So you have to make sure you ask for things well in advance so you don't have issues. The second time I applied, I did it relatively quickly. I remember it only really taking like a week or two because I was just putting all my documents together and like submitting everything and submitting all the paperwork. There's a lot of things to submit and fill out, a lot of paperwork. So, it can take a while if you don't have everything already lined up. So if you know anyone who's recently applied, ask all the things that you're going to need and start getting that information ready. So when your round of application opens, it's like June 1st or June something, maybe May, I don't remember exactly when it is. You want to be like within that first month, you want everything to be shipped off. So the second time I was able to do it right away. And like I didn't cancel my application. And I got so many interviews the second round, which I was already starting dental school, but like I said, I had already sent out the applications. I had gotten so many interviews the second time around. I was like, wow, the difference between applying early and applying late was just like drastic for me. Schools that never got back to me offered me interviews.
And then another question here was, when did you start preparing for the DAT? And would you recommend preparing for it during a certain year in undergrad?
Um, I can't remember exactly when I started preparing for it. Um, I mean, you want to apply pretty early on senior year, so I would say probably start preparing for it junior year. Um, I studied for about, I do remember that I lightened my load that semester. I think I only took 12 credits and I had like a golf class and a basketball class. I literally lightened my load to be like, I think it was like a 4 credit course and 2 3 credit courses, and then like a basketball class and a golf class. Like it was literally that easy of a schedule for me. So I had less things to review, less things to do in my own real like undergraduate study. So I took that semester to really start studying for the DAT. Just kind of passively like looking back through things and stuff like that, using those courses. I don't remember if that was the spring semester of junior year or the fall. I really can't remember. Or even the summer. I don't remember. It might have been the summer. And but I did take like a hard like 2 months or 3 months where I didn't go out. I pretty much just committed myself to studying and doing practice tests and things like that when I didn't have school stuff. I also tried to pick classes that were relevant to the DAT. Like I took like Orgo Lab or something like that, and things that were relevant and still within the bio credits. And that way I'm kind of reviewing while I'm studying for tests. I'm reviewing while I'm not.
And then another question here was, sorry if you answered this, but what age were you when you realized you wanted to be a dentist?
I would say I became super committed to it. When I went to college, when I applied from high school, I was already in the mindset of I'm very interested in dentistry. I hadn't really shadowed anyone to really like gain a love for it. I joined the pre-dental club as a freshman, and I started to get a little bit more interested in it. I would say I really became fully committed, and you could see it by my GPA difference between my freshman year when I was going out way too much and my sophomore year and junior year and senior year. But I would say my second
And
year of
then a
college.
question. Okay. And then another question was, did you take a gap year? If you did, what did you do?
No, I didn't. I almost did because, like I said, I had already reapplied. Um, I I was just planning on retaking the DAT and either working at like a dental office doing something for a year. I was really still trying to figure it out because at the point it was a little too late to apply to master's programs. Yeah, I really didn't have a solid plan yet. I was just still hoping that I'd get off the wait list. I had already started applying to new schools, and I didn't really know what I was going to do because I was actually still finishing up my last semester when I finally got accepted. But I didn't really have much plans. I was going to move back to Miami. I was going to find a local dental office to work at. I figured that could be a good foot in the door if I ever wanted to, get a job as an actual dentist once I finished dental school. Also to get me to learn a little bit more. So I probably would have worked as an assistant or done something along those lines for a year while I reapplied. I know plenty of
Okay.
people who did master's programs in their gap year.
Okay, yeah, that's true. Um, Also pertaining to like Pacific Dental Services, what kind of made you want to I guess partner up, is it, with like a specific dental service uh to start a practice? Was it like the money aspect? Was it that you like didn't really have experience? Yeah.
Yeah, so there was a couple things. We are not, like I said, I do have some family background in business, but we're not MBAs, we're not business geniuses and whizzes. Like we're taught to fix teeth. And I didn't really feel like I was an expert in that area, but I did want to run my own practice. Um, Running my own business and my own practice alone seemed very stressful. I didn't really know anyone who I felt like I could trust, who I can kind of lean on, like I said, like a family member who had done it before, or anything like that. So for me, the support of a company who I knew people who had worked for, or knew people who I've owned with, um, classmates older than me seemed like a good option. I interviewed, I met with people, I shadowed the offices, and uh, I really liked it. I mainly loved the fact that, if I was to go out on my own and finance a practice, there's no way I could afford the types of technology that they put in these offices. So I have all these cool things at my disposal, and they're constantly sending me to, CE courses to learn and, grow my practice, and giving me opportunities to upgrade my equipment, and things like that that I would never be able to afford to do on my own with student loan debt still, and wanting to start a life and buy a house and do all these kinds of things. It's just very expensive, and I just felt like I needed some kind of support system.
And then also to tag along to that, do you ever plan to, have your, because I know you do have your own practices, but like not be, I guess, partnering with a service?
No, I have no plans in doing that. I'm actually kind of growing within this platform. So I own two offices with them. I also train dentists at other offices on my days off sometimes. Like I'll go into an office, or I'll teach a class on like new technology things like using the CEREC and how to do anterior crowns for front teeth. And so I'm really really happy with the model. I'm really happy with being able to grow, and also just the fact that I'm able to own two offices and support two offices. Only 5 years out of school, 30 years old. I mean, it's just so hard to do that on your own. So also as I get older, I'm sure I'm not going to be able to keep up working as much hours and days and everything as I am now. So to get into that mentorship role, and with a good system and things like that, once I hit my 40s and 50s, seems like a nice way to slow down.
And then another question here was, how many dental schools did you actually apply to?
I don't remember exactly. I would kind of ballpark it. I think I applied to about 12 the first time around. And I applied to probably like 17 or 18 the second round that I didn't end up actually needing. That was a big waste of money. Um, but like I said, I actually plan to graduate in summer because I messed up a course in my senior year of college. My advisor didn't tell me I needed a certain course to finish, so I to take one class. It was only offered in the summer, so I ended up taking a class in the summer, and half the schools told me that they start before my class finishes, so I couldn't enroll in those schools. So like half my list got cut right away. And then I got four interviews the first time around. I got waitlisted at three of them and rejected from one. And then I was just sitting there waiting on the wait list. And then, like I said, the second round, I applied. I got a bunch of second, they send you for like more information. I got a bunch of like second, information things. And I probably already had like 7 or 8 interviews by the time like I hadn't even sent back half of those, just because I applied early and I applied to so many schools second time around.
And then another question here from the chat was, what was your most irregular case you've seen or had to work on? Just a fun question.
I mean, irregular is it's a tough question. I've seen a lot of things. I had a patient who I diagnosed with cancer on his tongue, squamous cell carcinoma, and he had to get his half of his tongue sectioned out. I've actually had like 2 or 3 cases where I saw something that looked really, really, off, and I was able to get them into a oral surgeon at a hospital clinic, and ended up finding out they had cancer and stuff like that. They were very appreciative. Those are probably the most irregular, most rewarding cases. Obviously, being able to detect something and help the patient. Um, as far as teeth go, though, um, the meth mouth cases are pretty interesting. You have like 25-year-olds who have holes in all their teeth. Those are pretty sad to see. Um, but you also see a lot of like irregular, like deformities of teeth. And I had a patient with 8 wisdom teeth. I had a patient who was congenitally missing a ton of teeth, just never got them. So I've seen a couple of cool things.
And then what would you say has been your biggest motivation throughout your dental journey?
Hmm, biggest motivation. I'm just very hard on myself, and I always I expect a lot, and I expect to do a perfect job. And when I'm seeing my patients and I feel like I could have provided a better service or I could have done better, it really kind of irks me. So just to be better and to be the best provider I can for my patients, and best leader I can for my team. I think learning from my mistakes is just my biggest motivation, just to be able to get better. Because sometimes you look back and you're just like, wow, I was an asshole. Or you look back and you're like, wow, like you look at a case you did 2, 3 years ago, and you're like, I could have done a better job. Let me redo this now. Or so just learning from my mistakes and just trying to be better, because these patients trust you and you want to do the best for them.
And then a little bit about the finance aspect, I guess, is do you think we should take any courses on business or things like that, or any tips for paying off like dental school loans?
Um, that's tricky. I was very happy that I didn't come out of undergrad with loans, because I went to a public school and I had a scholarship. So um, that was nice. I'm happy I did that. As far as dental schools, if you have an in-state dental school, it's going to be a lot cheaper than a private school or an out-of-state school. So, if you have that option, always apply to your in-state school and try to save some money. You're going to get a good education almost no matter what dental school you go to. Um, so I would definitely encourage you to try and do that. I went ahead and I refinanced my loans, because I think my rates were really high, like everyone else's are in these government loans are like 6, 7%. I was able to get really good rates, but with all that happened during COVID and stuff, doing a private loan, I had zero benefits. So everyone else who had a government funded loan didn't have to make payments, they didn't have to pay interest, they didn't have to do anything. I was still paying my normal payments, my normal interest, normal everything. So, if you had asked me a year ago, I would have said refinance 100%. You're going to save money. Seeing what I've seen this past year, I feel like I was at a disadvantage. And for example, if the president forgives student loans, I get no benefit. Where if you were still under your federal loans, even though you're paying higher interest, now you get whatever they decide to take off your loan is going to benefit you. So it's hard to say. Make it a manageable payment, but try to pay it off aggressively. Yeah.
And then another question was, as an undergrad, did you have a mentor that helped you guide? that helped guide you to where you are?
I had a couple of dentists, I can think of two, that were pretty cool about letting me shadow them and reach out to them for questions. Wrote me good letters of recommendation. One was in Miami, one was in Tallahassee. Um, I wouldn't say they were ended up being long-term mentors. I wish I would have kept touch. I actually did message the one in Miami who I was a little closer with um, not too long ago just to check up on her and stuff. So that was pretty nice. But I did have that, which was cool while I was, in the process of getting through things. So I definitely think it's very good if you can kind of build a relationship with a local dentist and you know offer to help them out, right? Like I take undergrad students and dental students and college students. I do tell them that if I'm going to be having you kind of follow me around and showing you things, I do also expect you to help out a little bit, like help the assistants clean or whatever it may be. Just because it does slow me down a little bit to kind of work with you sometimes. So whether it's suctioning chairside or it's cleaning up rooms and helping out, as long as they're willing to chip in, I definitely don't mind they come and get the experience of being in an office. I remember how hard it was for me to find places to shadow. So I do take a lot of shadows where I'm at now.
And then our last question for you is, what is your favorite procedure to perform?
Ooh, I would probably say, depending on the case, I really like doing like anterior aesthetic work, like veneers. Just because, to see the patients afterwards, it's really cool to be able to fix their smile. Um, but other than that, just as far as like which ones do I enjoy doing, not the reaction of the patient, because the reaction of the patient's obviously not as good, but I really like extractions and oral surgery. Probably doing impacted wisdom teeth, just like uncovering them and finding them and then taking them out. Pretty cool for me.
All right, well, that's going to conclude the questions. I'm not sure if you have another slide so they can contact you if they need to.
Oh, you did know I had that.
Okay, cool.
Yes. Yes, guys, this is my email address, my cell phone, and this is my Instagram. Like I said, I'm really bad at posting. I'll try and be better. I promise. My fiance keeps bothering me about it. I'll try and take more pictures. I'll try and post more. I will do my best. If you have any questions for me, please, just reference that you had, were in this chat and email me to azadia@pacden.com and I can try and answer any of your questions when I have a chance. If you are in the area and you wanted to shadow me or something like that or assist or whatever it is, you could text me and I can get back to you as well.
Awesome. Thank you so much, Dr. Azadi. Guys, the post-session quiz link is in the chat and it's also going to be in our link tree. You guys can go ahead and leave messages for Dr. Azadi. He'll see those later. This is going to be worth 1 hour of shadowing. And yeah, that's going to conclude our session.
Thank you guys for all the great questions and thank you for setting this up. This is awesome.